Australia, there are 5 triage categories. Now we're going to explain each of those triage categories and work out what sort of patient belongs to which category. Category 1 is immediately life-threatening. And what this means is the person must be seen immediately or they're going to die. So these are reserved for people that have had their heart stop or maybe severe anaphylaxis and they can no longer breathe, anaphylaxis being an allergic reaction. So the Australian Institute of Health and Welfare did a study in 2011 and 12, and they revealed that less than 1% of all triages were a Category 1. And what this means is that the triage nurses are doing their job. They are holding that category for people that really need it, that really need emergency care. So there are a few ways that people can arrive to the hospital that are a Category 1. One is they can come by ambulance, and this is certainly the most common way. And this means that they've been seen by the ambulance. The ambulance can decide whether they're going to go their full protocol, which means they give all the drugs and everything that they need to do at the scene, or they can decide that this person's critically ill and they don't have enough resources or people there, so they're going to scoop and run. So they secure the airway, they load them and they take them to the emergency department. Usually they call to give us a bit of a heads up that they're on the way so that we can scramble and start to prepare staff as well as resources. Another way that a Category 1 might present is by car. So sometimes someone might say to their son, "Can you please drive me to the hospital? I've got some chest pain." And by the time they actually arrive to the emergency department, they're in full arrest. And what that means is that their heart has actually stopped. It's our role then to try to get them out of the car, bring them into the emergency department and resuscitate them. They are a Category 1 and they need immediate care or they will die. So let's now talk about Category 2s. Category 2s are patients that need to be seen within 10 minutes. And what that means is that they've got imminently life-threatening conditions. The Australian Institute of Health and Welfare in 2011 and 12 revealed that 10% of all patients that were triaged were a Category 2. So let's examine what a Category 2 is. It might include things like severe chest pain, severe pain, difficulty breathing, severe fractures, or particularly a group of conditions together. For example, that someone had had a car accident and they might have severe leg pain because of fractures, but they also might have chest pain. So let's look at a cardiac example. If somebody presents with severe chest pain, they're pale, they're sweaty, they've got a cardiac history, but they're still talking to you, 10 minutes, they're not going to wait 10 minutes for any treatment at all. What's going to happen is they're going to be brought into the emergency department. They're going to have an electrocardiograph, that is an ECG or a reading of the heart rhythm. They might have bloods taken immediately. They're going to have oxygen put on, and this is to reduce myocardial demand, that is to reduce the strain on the heart. And then the doctor is going to see them. So why aren't they a Category 1? They're pretty sick. They're not a Category 1 because they haven't arrested yet. Their heart has not stopped. If their heart does stop, they would have been a Category 1. A Category 3 is another triage category in the Australian system. This means that the person needs to be seen within 30 minutes of arrival, as they do have a potentially life-threatening condition. So think of someone that has a severe illness, bleeding or a migraine. Now, if any of you have ever had a migraine, you know it's pretty severe, and you probably think to yourself, 30 minutes is a long time. But think of the other presentations that are there. You can wait 30 minutes for treatment, but it's not necessarily that you're going to be having no treatment at all. What they have is initiated treatment from the triage nurse. They might be able to give some pain relief. And there are also things called SIN nurses or clinical initiation nurses. These are new, and what they do is they assess people in the waiting room. They're very senior registered nurses, and they watch these people to make sure they don't deteriorate at all while they're waiting in the waiting room. So let's think of a dehydrated person as a Category 3. The Category 3 dehydrated person is conscious, but they might be very, very dry, cracked lips, very dry mouth, and they might be quite unwell. They need to be seen. They can wait about half an hour. If we're talking about comparing to someone that's heart stopped, they definitely can wait. Somebody that's dehydrated that's no longer conscious though is a different matter. So these people can no longer protect their airway, so their triage category would go up because they need to be seen more urgently. A Category 4 is another triage category, and that means that the person needs to be seen within 1 hour. they've got a potentially serious condition, and that might include things such as a foreign body to the eye, or a sprained ankle. It could be a less severe migraine or an earache. Again, if any of you have had any of these symptoms, you might think, gosh, an hour is a long time to wait. But again, we're looking at the whole picture of emergency department. Some with their heart stopped, some with severe asthma attacks, and others with a sprained ankle that needs to be treated. So think of somebody with a foreign body to the eye. Those that have a slight metal fragment compared to somebody that has a nail sticking through their eye are very different triage categories. So a category 4 might be someone that's got a little bit of fragment, maybe a little bit of rust around it, and maybe they have some irritation to the eye. But if somebody came in with an actual nail in the eye, where the globe of the eye was damaged, then they would definitely be a higher category because they're likely to lose their vision. Category 5 is another Australian triage category, and this is reserved for people that have minor illnesses that need to be seen in about 2 hours after arrival. There are things such as minor illnesses, aches and pains, and people that are generally unwell. As we discussed before, this group of people could more than likely be seen by their general practitioner. So let's think about the overarching view of the emergency department at this point in time. If there was no one else there, they would be seen. But if there was a category 1 that had stopped breathing, then obviously they need to be seen first. So what does happen to these people that do come through the emergency department? About 28% of people are admitted to the hospital, which doesn't seem a great deal considering there are 6.5 million presentations per year. 63% are treated in emergency and sent home. Less than 5% don't wait for treatment, and this is actually quite a good statistic. So these are people that turn up to emergency department. They generally are triaged by the triage nurse, but they don't wait for treatment. We really don't want people to go without being treated first. It's really important they stay, because in some circumstances, people get anxious and they want to leave, and they actually do need treatment. Some people begin treatment and they leave at their own risk, which means that they've started their treatment and they might feel better, but we're not quite happy for them to go yet, but they decide to leave. Some people unfortunately will die in emergency, where others will be dead on arrival. So as you can see, the emergency department is a very exciting place to work. There's lots of different people you'll come across, lots of different illnesses, and we've discussed what triage is and how we're going to categorise these people so that they're seen in an appropriate period of time. Next, we'll meet an amazing emergency nurse who I've worked with for many years. She has an extensive history in emergency and she can give us some insight on what it's like working in this department.